Happy Tuesday. Welcome to another anatomy lesson. If you recall, last week we talked about the pelvis and the hip. Now we're going to move down a little bit more distally to the femur. Hope everyone is doing good. The femur is the longest and strongest bone in your body. It plays an important role in how you stand, move, and keep your balance. Femurs usually only break from serious traumas like car accidents. But if your bones are weakened by osteoporosis, you may have an increased risk for fractures you might not even know about. What is the femur? The femur is your thigh bone. It's the longest, strongest in your body. It's a critical part of your ability to stand and move. Your femur also supports lots of important muscles, tendons, ligaments, and also parts of your circulatory system. Your femur, like all bones, can be affected by osteoporosis. Where is the femur located? The femur is located only in your thigh. It runs from your hip to your knee. It's labeled 3 different sections: proximal, mid-shaft, and distal. If you haven't gone and looked at the video for all of the medical terms, you might want to go back and check that out so you'll know what proximal, distal means, as well as other things we're going to be talking about in this lesson and future lessons. The upper or proximal end of your femur connects to your hip joint. We talked about that last week. The proximal end aspect contains the head, the neck, the greater trochanter, lesser trochanter, intertrochanteric line, and the crest. Femur shaft. The femur shaft is the longest portion of the femur that supports your weight and forms the structure of your thigh. It angles slightly toward the center of your body. The shaft of your femur includes the linea aspera, gluteal tuberosity, pectineal line, popliteal fossa, medial and lateral epicondyles, medial and lateral condyles, and also the intercondylar fossa. All of these parts or labels are more for your healthcare provider, but I'm also going to show you what they look like. So how big is the femur? As we talked about twice already, the femur is the largest bone in your body. Most adult femurs are around 18 inches long. The femur is also the strongest bone in your body, as we've already previously discussed. It can support as much as 30 times of the body weight. 30 times of the body weight. So what are the common conditions and disorders that can affect the femur? The most common issue that affects the femurs are fractures, osteoporosis, and patellofemoral pain syndrome. Patellofemoral means the patella, the kneecap, and the femur. Patellofemoral pain. A bone fracture, in the medical term, is for breaking a bone. Because femurs are so strong, they're usually only broken by serious injuries like car accidents, falls, or other traumas. Symptoms of a fracture can include pain, swelling, tenderness, inability to move your leg like you usually can, bruising or discoloration. And also, another Another symptom could be a deformity or bump that's not usually on your body. Very important to go to the emergency room right away if you've experienced a trauma and think you have a fracture. Very important. Women, people assigned female at birth, adults older than 50, have a higher risk for osteoporosis. Talk to your provider about a bone density scan to catch osteoporosis before it causes a fracture. We talked a little bit about patellofemoral pain. What does that entail? How do we know? What do we know? How do we know if we have patellofemoral pain syndrome? Because we have pain around and under your kneecap, patella. It's sometimes called runner's or jumper's knees. And for now, we're going to call it PFPS, patellofemoral pain syndrome. PFPS can be caused by everything from overusing your knees to getting new shoes. Symptoms of PFPS include pain while bending your knee, including squatting or climbing chairs, pain after sitting with your knees bent, crackling or popping sounds in your knee when standing up or climbing stairs. Pain increases when changes to your usual playing surface, sports, equipment, or activity intensity. What tests are done on the femurs? The most common test done to check the health of your femur is once again a bone density scan. It's sometimes called a DEXA or DXA scan. A bone density test can also be done, or x-rays, MRI, or CT scans. What are the most common treatments for femurs? Usually, your femur won't need treatment unless you've experienced a fracture, of course, or have been diagnosed with osteoporosis. Femur fracture treatment. We've already talked about it's the strongest bone in your body. It's very hard to break. But when it does break, you have to seek treatment. So how is your fracture treated will depend on what type and what it's caused by. So you're going to need some kind of splint or a cast, and will probably need surgery to realign or set the bone to correct the position and secure it in place so it can heal. Well, what about osteoporosis? What if we have that? Treatment for osteoporosis can include exercise, vitamin and mineral supplements, and medications. Exercise and taking supplements are usually all you need to prevent osteoporosis. Your doctor will help you develop a treatment plan that's customized for you and your bone health. Very important to get regular checkups to help you maintain your bone and overall health, especially if you're older than 50. Also follow general safety rules to reduce your risk of injury. Always wear your seatbelt. Wear the right protective equipment for all activities and sports. Make sure your home and workplace are free from clutter that could trip you or others. Always use the proper tools or equipment at home to reach things. Never stand on chairs, tables, or countertops. Also, follow a diet and exercise plan that will help you maintain good bone health. Now I'm going to show you some diagrams of the femur, what they look like. Now, if you go back to last week's lesson, you'll remember that we talked about the head of the femur, the neck of the femur, greater trochanter, lesser trochanter, and an intertrochanteric line. Okay? So let's see where those are. Let's just get those up real quick. I'm also going to show you a fracture. Also going to show you a rotting. So once again, last week, the star is the head of the femur. This is the neck of the femur. Greater trochanter, lesser trochanter, intratrochanteric line, which means in between the trochanters. This is the shaft or body of the femur. Comes all the way down here to the condyles, epicondyles, and the fossa, the patella fossa right there. Okay? So once again, medial epicondyles. Let me fold it in half. Hope you can see it. Medial epicondyles. Lateral epicondyle. Condyle over here. We have one on each side of the femur. Okay, we have a medial epicondyle inside, lateral epicondyle outside, lateral condyle, medial condyle. Okay, and then the fossa is right there in the middle between the condyles. Epicondyle, condyles, fossa. That's the fossa, but patellar fossa. Now, let's get into a little bit of what the actual femur has, okay? Then I will show you some pictures and we'll be done. So we have articular cartilage, spongy bone, epiphyseal line, red bone marrow, endosteum, compact bone, medullary cavity, yellow bone marrow, periosteum, nutrient artery, articular cartilage, proximal epiphysis, metaphysis, diaphysis, metaphysis, distal epiphysis. The epiphyses are joined together as you grow. When you're born, you have two that are separated. As you grow, they come together. Okay? So proximal epiphysis, metaphysis, spongy bone, epiphyseal line. That's where they come together. You have red bone marrow, compact bone, endosteum here, medullary cavity, the very outside, yellow bone marrow, periosteum, nutrient artery. Here's an artery. Metaphysis, distal epiphysis, because it's a long bone, so it's going to join up here. It's going to join down here with the tibia fibia. We're going to be going over the tibia and fibia next week, as well as the knee. The knee is created by the femur and the tibia fibula. We're going to learn about that next week, along with the patella, the kneecap, okay? Here is a fracture. Do you remember last week we had a fracture of the femoral head and neck? This is a little more distal. The shaft is down here, but a little more distal. Greater trochanter, that's a trochanter would be over here. Here is a fracture, not in the hip, but the femur. Hip is here. Here's the acetabulum. This is the head of the femur, neck of the femur, greater trochanter again. This is a fracture. It's in two pieces. Okay? How can they fix that? Or what if you have a tumor? What if you have a tumor? This is a picture of part of the femur with the tumor. Here's the fracture line. It's an actual picture of a human femur, a little bit, not the whole thing, a little bit. This would be how they would fix it. So the one that had the fracture up here, they could put a rod here. Might not be all the way. This happens to be a tumor in the mid femur. So we have proximal, mid shaft, distal down here toward the knee, where the knee would be. This is going to be the condyles down here. They actually put a rod to stabilize it. I had 3 pictures of the same one. See, they have put screws through and one long rod going down. This just shows the healing process. Just getting started. Few weeks in. And now you can see it's kind of starting to grow. Starting to grow again. It will grow just like that. So you can barely tell. It'll start to grow. So I hope you've enjoyed this lesson on the femur. Next week, once again, we'll be going over the knee and the tibia and the fibula. Have a good night, and I will see you next week. If you haven't gone back, look at the previous videos. Go back and look. Go back and orientate yourself to what we're talking about week after week. It will help you. It will help you understand what's going on. Have a good night. See you later.